Have you heard about the recent outbreak of white lung syndrome? This novel strain of bacterial pneumonia is making headlines for all the wrong reasons. It's not just a common cold that's got the world on high alert. We're dealing with a potent infection that's proving resistant to many antibiotics. Predominantly affecting children between the ages of 3 and 8, this disease has rapidly swept across different parts of the globe. From the bustling cities of China, to the tranquil landscapes of Denmark, from the vast expanses of the United States to the picturesque Netherlands, no corner seems immune. The world is grappling with this new health challenge, and the questions are mounting. What's causing white lung syndrome? Why is it spreading so quickly? And most importantly, how can we protect our little ones from it? In the next few minutes, we will delve into the causes of this pneumonia, its rapid growth, and what we can do to stay safe. So stick around, let's untangle the mystery behind white lung syndrome together. Do you know what causes white lung syndrome? Let's dive into it. White lung syndrome, a novel strain of bacterial pneumonia, is caused by a particularly stubborn bacterium known as Mycoplasma pneumonia. This microscopic culprit is not your average bacterium. It's notorious for its resistance to many antibiotics, which makes treating this disease a significant challenge. Mycoplasma pneumonia invades the respiratory system, causing inflammation and damage within the lungs. This leads to the characteristic white lung appearance on medical imaging, hence the name white lung syndrome. This bacterium is primarily airborne, spreading through droplets expelled when an infected person coughs or sneezes. This mode of transmission, combined with its resistance to antibiotics, contributes to the rapid and widespread outbreaks we are witnessing today. Unlike many other bacteria, Mycoplasma pneumonia doesn't have a cell wall. Why is this important? Well, most antibiotics work by disrupting the cell wall, but without one, these drugs are rendered ineffective. The lack of a cell wall also allows the bacterium to change shape and squeeze into tiny places, making it a master of evasion and survival. In addition to this, Mycoplasma pneumonia has another trick up its sleeve. It can hide inside the body's cells, effectively shielding itself from the immune system and further complicating treatment. This ability to adapt and survive in various conditions is a key factor in its potency and the resulting white lung syndrome. Understanding the cause of this disease is the first step towards controlling its spread and impact. In the next segment, we'll discuss the rapid growth and areas of impact of this disease. Stay tuned. How quickly is white lung syndrome spreading, and where are the areas of impact? The spread of white lung syndrome has been alarmingly rapid, with cases popping up across the globe in a relatively short span of time. The disease has notably impacted children between the ages of 3 and 8, a group particularly vulnerable due to their developing immune systems. In terms of geography, the disease has made its presence known in a variety of regions, from the United States to Denmark, and from China to the Netherlands. This global reach is a clear indication of the disease's ability to cross borders and affect populations worldwide. What's particularly concerning is the resistance of the bacteria causing white lung syndrome to many antibiotics. This resistance not only complicates treatment, but also contributes to the rapid proliferation of the disease. With each passing day, the number of affected children grows, underscoring the urgency of addressing this public health issue. Given the rapid spread of this disease, it's crucial we understand how to stay safe. What can we do to stay safe, and what are the next steps to combat the surge of white lung syndrome? In the face of this outbreak, there are steps we can take to protect ourselves and our little ones. Emphasizing good hygiene is crucial. Encourage your children to wash their hands often, especially after playing outside or being in public places. Teach them to cover their mouths when they cough or sneeze, and to avoid close contact with anyone who appears to be ill. Regular medical checkups are also vital. Early detection can make a significant difference, so be sure to keep up with your child's health appointments and bring up any concerns with your healthcare provider. Beyond individual actions, there's a broader fight taking place against white lung syndrome. Scientists and doctors around the world are working tirelessly to understand this disease better. They're investigating its causes, how it spreads, and most importantly, how to treat it effectively. There's ongoing research into antibiotics that might combat this resistant strain of bacteria, and the development of potential vaccines is another avenue being explored. In the meantime, public health organizations are doing their part by monitoring the situation closely, spreading awareness, and providing updates on any progress made. We can support these efforts by staying informed, following advice from trusted health sources, and sharing accurate information with our communities. By staying informed and taking the necessary precautions, we can all play a role in the fight against white lung syndrome.